Welcome to Dr. Adevin's channel. I'm Dr. Adevin, and I've been practicing cardiology for nearly 2 decades. Today, I want to talk about something that happens in medical offices across the country every single day. Something that affects millions of people. And yet, it's rarely discussed openly. Your doctor suggests increasing your blood pressure medication. Your numbers have been creeping up. They're not quite at goal, so the logical next step seems to be to increase the dose or add another medication. It happens in routine office visits. It happens during telehealth appointments. It happens almost automatically, without much discussion or exploration of alternatives. And while medication is absolutely necessary for many people, I want to help you understand what should happen before that increase occurs, what questions you should ask, and what other factors might be contributing to rising blood pressure that aren't being addressed. Let me be clear from the start. I'm not anti-medication. I'm not suggesting that you should never increase blood pressure medications or that medications are somehow bad. Blood pressure medications save lives. They prevent strokes. They prevent heart attacks. They prevent kidney disease. For many people, they're essential and life-saving. But what concerns me, based on my clinical experience and based on the research, is that medication increases sometimes happen without fully exploring whether other modifiable factors are driving the rising blood pressure. Sometimes the increase is necessary. Sometimes it's not. And sometimes there are strategies that could be employed before increasing medication that might bring you to goal without additional medication or with lower doses. Here's what typically happens. A patient comes in for a regular appointment. Their blood pressure is measured and it's higher than last time or higher than goal. The doctor looks at the chart, sees the upward trend, and says something like, "Your blood pressure is up. Let's increase your medication." Then either the patient says, "Okay," or they ask a few questions about side effects, and then they're prescribed a higher dose or an additional medication. The visit is over in 15 minutes. What rarely happens is a thorough investigation into what might have changed in the patient's life that could be causing the increase. What changed in the past month or 3 months? What's your stress level like? How's your sleep? Have you changed your diet? Are you exercising? What's your sodium intake? Have you gained weight? Are there new life stressors? Have you skipped medications? This investigation almost never happens. Or if it does, it's cursory at best. I want to walk you through what I believe should happen before a medication increase is recommended. What questions should be asked, what investigation should be done, and why this matters for your long-term health and medication burden. The first and most critical thing is to establish whether the blood pressure reading that prompted the medication increase is accurate. This might sound obvious, but errors in blood pressure measurement are more common than you might think. Many office blood pressures are taken incorrectly, which leads to falsely elevated readings. The patient comes in. They're anxious about the appointment. They've been sitting in a waiting room. They might have had coffee. They might have used the bathroom recently. All of these things affect blood pressure. The proper way to measure blood pressure is in a relaxed, seated position with feet flat on the floor, back supported, arm at heart level after at least 5 minutes of quiet sitting. The cuff should be appropriately sized for the patient's arm. Many office blood pressure cuffs are too small, which gives falsely elevated readings. The measurement should be taken on both arms, and the average should be calculated. In many office visits, none of these things happen properly. The patient sits down, the cuff is placed, a reading is taken, often while the patient is still settling in. Is it any wonder that office blood pressures are often elevated? This is why home blood pressure monitoring is so important. When I see a patient whose office blood pressure is elevated, the first thing I do is ask about home readings. Do you have a blood pressure monitor at home? What are your readings at home? If the patient doesn't have a monitor, I recommend getting one, a validated one, and taking readings for at least a week before we make any medication changes. The American Heart Association recommends that if a medication increase is being considered based on office readings, home blood pressure monitoring should be done to confirm that the elevation is real and not an artifact of office anxiety or measurement error. One of my patients came in with an office reading of 152/92. His doctor recommended increasing his blood pressure medication. But when I asked about home readings, he said he hadn't been checking at home. I had him purchase a validated home blood pressure monitor and take readings twice daily for 2 weeks. His average home reading was 128/84, which is well controlled on his current medication. The office reading was high due to white coat effect, anxiety about the doctor's visit. His medication didn't need to be increased at all. Had he not had those home readings, he would have been started on a higher dose of medication unnecessarily. The second critical investigation is a thorough medication adherence assessment. Have you been taking your blood pressure medications as prescribed? This sounds like a simple question, but non-adherence is incredibly common and is often the actual cause of rising blood pressure, not the need for more medication. Studies show that roughly 50% of patients don't take their blood pressure medications as prescribed. Some miss doses. Some take them inconsistently. Some stop taking them altogether because they feel fine or because of side effects they haven't mentioned to their doctor. If someone has been missing doses, the solution isn't to increase the medication. The solution is to address the adherence issue. I've had patients tell me, only after I specifically asked, that they stopped taking their medication because it caused erectile dysfunction, or because it made them dizzy, or because they forgot to take it regularly. If they had simply told their doctor, we could have switched to a different medication or found solutions to the side effects. Instead, they just stopped taking it and then were surprised when their blood pressure went up. Before any medication increase is contemplated, there should be a detailed conversation about adherence. Are you taking your medications? If not, why not? Are there side effects? Are you struggling to remember? Is cost an issue? Once these barriers are addressed, blood pressure often improves without any increase in medication. The third investigation is a dietary assessment, specifically sodium intake. Sodium is one of the most powerful drivers of blood pressure, and it's something that can change relatively quickly if addressed. Have you changed your diet in the past few months? Are you eating more processed foods? Are you eating out more frequently? Are you consuming more salt? Many patients don't realize how much sodium they're consuming because much of it comes from processed foods, not from salt shakers. If a patient's sodium intake has increased, that could easily explain rising blood pressure. And importantly, reducing sodium can bring blood pressure down relatively quickly, often within weeks. Before increasing medication, sodium intake should be thoroughly assessed and addressed if elevated. One patient of mine had blood pressure that had gradually increased from 128 to 142 over the course of 3 months. When I asked about dietary changes, he mentioned that he'd been eating more deli sandwiches for lunch because of a new job. Deli meats are extremely high in sodium. A single sandwich could contain more than 1,000 milligrams of sodium. Combined with processed snacks and canned soups, his daily sodium intake had increased from roughly 2,000 milligrams to about 4,000 milligrams. I recommended reducing processed foods and preparing more meals at home. Within 4 weeks, his blood pressure had dropped back to 128. His medication didn't need to be changed at all. The problem was dietary, not pharmaceutical. The fourth investigation is stress and sleep assessment. Both of these are powerful drivers of blood pressure, and both can change relatively quickly with intervention. How's your stress level? Have there been major life changes recently? How's your sleep? Are you sleeping well? Are you waking up rested? Many patients experience elevated blood pressure during periods of high stress. Some experience elevated blood pressure during periods of poor sleep. If either of these is the cause of the rising blood pressure, the solution might not be more medication. The solution might be stress management techniques, sleep improvement strategies, or potentially therapy or counseling. I had a patient whose blood pressure increased significantly during the months following her husband's death. Her office readings were 150 and higher. Her doctor wanted to increase her medication. But when I spoke with her, I learned that she was grieving, barely sleeping, and under enormous emotional stress. Increasing her blood pressure medication wasn't addressing the root cause. Instead, I referred her to grief counseling, recommended she work with a sleep specialist to improve her sleep, and suggested stress management techniques. Within 3 months, as she processed her grief and her sleep improved, her blood pressure naturally decreased. The medication increase was never necessary. The fifth investigation is weight and physical activity. Have you gained weight recently? Are you exercising regularly? Weight gain is one of the most common reasons for rising blood pressure in patients who previously had good control. Each kilogram of weight gain is associated with roughly 1 millimeter of mercury increase in blood pressure. So if a patient has gained 5 kilograms, that alone could account for a 5-point increase in blood pressure. Conversely, weight loss, even modest weight loss of 5 to 10% of body weight, can significantly reduce blood pressure. Additionally, sedentary behavior can drive up blood pressure while regular physical activity reduces it. Before increasing medication, current weight and activity level should be assessed, and if either has changed unfavorably, these should be addressed first. The sixth investigation is medication interactions and side effects. Are you taking any new medications, supplements, or over-the-counter products that might be raising your blood pressure? This is critical because many medications and supplements raise blood pressure as a side effect. Non-steroidal anti-inflammatory drugs like ibuprofen can raise blood pressure. Decongestants used for cold and allergy symptoms can raise blood pressure. Oral contraceptives can raise blood pressure. Certain supplements like licorice, ginseng, and high-dose caffeine supplements can raise blood pressure. If a patient has started a new medication or supplement that's known to raise blood pressure, the solution might be to discontinue it or switch to an alternative, not to add more blood pressure medication. I had a patient whose blood pressure started rising after she began using an over-the-counter decongestant for chronic nasal congestion. She was using it daily, and she didn't think to mention it to her doctor. When we identified the cause, she switched to nasal saline and other decongestant alternatives, and her blood pressure returned to normal. If her doctor had simply increased her medication without investigating, she would have been on unnecessary additional medication while the actual cause went unaddressed. The seventh investigation is screening for secondary causes of hypertension. In most cases, high blood pressure is primary, meaning there's no underlying cause, and it's related to genetics, lifestyle, and age. But in roughly 5 to 10% of cases, high blood pressure is secondary, meaning it's caused by an underlying medical condition. If someone's blood pressure has been well controlled and then suddenly rises, this might indicate a secondary cause that's developed. Potential secondary causes include kidney disease, thyroid disease, sleep apnea, adrenal disorders, and others. These would need specific testing and treatment that's different from simply increasing blood pressure medication. Before a medication increase is prescribed, if there's been a significant change in blood pressure or an unexplained rise, it's reasonable to screen for secondary causes, particularly if the patient hasn't had recent blood work or hasn't been screened for conditions like sleep apnea. This doesn't mean extensive testing in every case, but it means being aware of the possibility and asking the right questions and ordering appropriate tests if indicated. The eighth thing to consider is the timing and frequency of blood pressure measurements. Blood pressure varies throughout the day. It's lower in the evening and higher in the morning. It's higher with stress and activity and lower with relaxation. A single elevated reading, or even a few elevated readings, don't necessarily mean that medication needs to be increased. The American Heart Association recommends that diagnosis of hypertension and decisions about medication changes be based on multiple readings taken over time, not on single readings or office readings alone. If someone has had a few elevated readings, the appropriate response is to repeat measurements over the next few weeks before making medication changes. Now, let me address the situation where, after thorough investigation, it does appear that a medication increase is appropriate. What should the process look like? First, there should be a detailed discussion about the reason for the increase. Why is your blood pressure still above goal? Is it because you haven't been able to reduce other risk factors? Is it because you're at an age where medication increases are often necessary for goal achievement? Is it because you have specific risk factors that warrant tighter control? Second, there should be a discussion about what type of medication increase is being recommended. Are we increasing the dose of a current medication, or are we adding a new medication? Both have different implications. Increasing a dose of a current medication might increase side effects. Adding a new medication means more pills to take, potentially more side effects, and more complex medication management. The choice between these should be discussed and should take into account your preferences, side effect tolerance, and other factors. Third, there should be a discussion about the expected benefit. How much blood pressure reduction do we expect from this increase? How long will it take to see the benefit? When should we recheck to see if the increase is working? Many doctors prescribe a medication increase and then don't follow up to see if it actually worked. You should know what the goal is, and you should have a plan for reassessment. Fourth, there should be a discussion about side effects and monitoring. What side effects might occur with this increase? How should they be managed? Are there any interactions with other medications? Will any additional monitoring be needed? Fifth, there should be an agreement about what happens if this increase doesn't achieve your goal. Is there a next step? What would that be? Would it be another medication increase, a different medication, or a focus on other lifestyle factors? Let me share some clinical scenarios to illustrate these principles. One patient came to me for a second opinion after his doctor recommended increasing his blood pressure medication from 1 to 2 medications. His blood pressure in the office was 145/90. But when I reviewed his records, I saw that his home readings, which he'd been taking faithfully, were averaging 132/84, which is control. His office reading was white coat effect. His medication didn't need to be increased. I recommended continuing his current medication and continuing home monitoring. Another patient had blood pressure that was well controlled on one medication for 3 years, and then it started creeping up. Over the course of 2 months, her office readings went from 128 to 142. Her doctor recommended increasing her medication. But before doing so, I asked detailed questions. Had anything changed in her life? Yes. She'd started a new job that was quite stressful, and she was sleeping poorly because of the stress. I recommended she work with the stress and the sleep issues. We didn't increase her medication immediately. Within 2 months, as she adjusted to her new job and her sleep improved, her blood pressure came back down to 128. The medication increase was never necessary. Another patient had been on a stable blood pressure medication for years with good control. Then his blood pressure rose significantly over a few weeks. Standard protocol would be to increase the medication. But I asked if anything else had changed. Yes, he'd started taking a non-steroidal anti-inflammatory drug for arthritis pain. He was taking ibuprofen daily. That was raising his blood pressure. We switched to a different pain management approach, and his blood pressure came back down. Again, a medication increase was unnecessary. These aren't unusual cases. This is the norm in my practice. Before blood pressure medications are increased, there's almost always something else that can be addressed first. This isn't to say that medication increases are never appropriate. They often are. But they should be thoughtful, evidence-based decisions made after thorough investigation, not automatic reflexes based on a single elevated office reading. Here's what I want you to do if your doctor recommends increasing your blood pressure medication. First, ask for a copy of your recent blood pressure readings. Look at the pattern. Is there a clear upward trend, or are there just 1 or 2 elevated readings? Second, if you don't have a home blood pressure monitor, get one and take readings for 2 weeks before the medication increase. Third, think about what's changed in your life recently. Have you gained weight? Has your diet changed? Is your stress higher? Is your sleep worse? Have you started a new medication or supplement? Have you been taking your current medications consistently? Fourth, ask your doctor about these potential factors. Is your doctor investigating the cause of the rising blood pressure, or are they simply increasing medication? Fifth, ask about the expected benefit. How much will your blood pressure drop with this increase? How long will it take to see the benefit? Sixth, get a clear plan for follow-up. When will you recheck your blood pressure to see if the increase worked? If your doctor isn't interested in investigating potential causes, or if you feel like the medication increase might not be necessary, don't hesitate to get a second opinion. Medication is important and necessary for many people, but unnecessary medication increases mean you're taking more pills, you're exposed to more side effects, and you might miss opportunities to address modifiable factors that could reduce your blood pressure naturally. Let me also address the situation where lifestyle modifications alone haven't achieved blood pressure goal after a reasonable trial period. In this case, medication increases are often appropriate and necessary after 3 to 4 months of consistent adherence to all the lifestyle modifications. If blood pressure is still above goal, medication increases become more justified. The key is that this is a trial period, and you're really committing to the lifestyle changes before adding or increasing medications. I also want to address the issue of side effects from blood pressure medications. Many patients experience side effects but don't mention them to their doctor because they think they should just accept them. Common side effects include fatigue, dizziness, sexual dysfunction, cough, and others. If you're experiencing side effects from a medication, this should absolutely be discussed with your doctor before increasing that medication. There might be alternatives that work just as well, but with fewer side effects. You shouldn't have to suffer side effects as the price of blood pressure management. There are usually solutions. In conclusion, before your blood pressure medication is increased, several things should happen. Your blood pressure reading should be confirmed with home monitoring to exclude white coat effect. Your medication adherence should be assessed. Your diet, particularly sodium intake, should be reviewed. Your stress level and sleep quality should be evaluated. Your weight and activity level should be assessed. Any new medications or supplements should be reviewed for their potential to raise blood pressure. Screening for secondary causes should be considered if appropriate. And only after all of these factors have been thoroughly investigated and addressed, where possible, should a medication increase be contemplated. This approach leads to better outcomes, lower medication burdens, and more engaged patients who understand their blood pressure management and are taking an active role in their health. If your doctor is recommending a medication increase, don't hesitate to ask these questions. A good doctor will be happy to engage in this conversation. Your health depends on thoughtful, evidence-based decision-making, not on automatic medication increases. Thank you for watching. Subscribe to Dr. Adevin's channel for more information on cardiovascular health and medication management. Take care of yourself.